A nursing assistant notices a resident's dentures are missing during breakfast. What should the CNA do first? A. Inform the charge nurse immediately. B. Search the meal tray and napkin area. C. Ask another resident if they have seen them. D. Check the resident's room later in the day. Answer: B. CNA should first search the immediate area to prevent damage or accidental disposal, then report the incident to the nurse promptly. When providing care to a resident with expressive aphasia, the CNA should: A. Finish their sentences for them. B. Use yes/no questions and allow time to respond. C. Avoid communication to reduce frustration. D. Speak louder and faster. Answer: B. Residents with expressive aphasia need extra time and simple communication methods to express their needs effectively and respectfully. A resident refuses a morning bath, stating they prefer evenings. The CNA should: A. Insist because it's scheduled for the morning. B. Document the refusal only. C. Respect their preference and reschedule the bath. D. Ask another CNA to do it later without asking the resident. Answer: C. Respecting resident preferences promotes dignity and autonomy, key principles of person-centered care. While transferring a resident with one-sided weakness, the CNA should position themselves: A. On the resident's strong side. B. Behind the wheelchair. C. On the resident's weak side. D. In front of the resident. Answer: C. Standing on the weak side offers support and stability, preventing falls during transfers. When should the CNA perform hand hygiene during perineal care? A. Before and after the procedure only. B. After removing gloves only. C. Before, after, and if gloves are torn during care. D. Only if hands appear soiled. Answer: C. Hand hygiene before, after, and whenever contamination occurs is essential to prevent cross-infection. A CNA observes a coworker verbally scolding a resident. The CNA should: A. Ignore it to avoid conflict. B. Report the incident to the charge nurse immediately. C. Wait to see if it happens again. D. Confront the coworker loudly. Answer: B. Verbal abuse is a serious form of mistreatment. It must be reported immediately as part of the CNA's legal and ethical duty. What is the best way to prevent pressure ulcers in a bedbound resident? A. Keep the sheets tight under the resident. B. Reposition the resident every 2 hours. C. Use more pillows for comfort. D. Apply lotion daily. Answer: B. Frequent repositioning relieves pressure and restores blood flow to tissues, preventing skin breakdown. A resident who is usually calm suddenly becomes agitated and confused. The CNA should first: A. Report the change to the nurse. B. Try to calm them with food. C. Ignore it if they are not harmful. D. Offer medication. Answer: A. Sudden behavior changes may indicate medical issues like infection or medication reactions. The nurse must be informed immediately. The CNA finds a resident on the floor but not visibly injured. What is the CNA's first action? A. Help them up quickly. B. Check for breathing and injuries before moving. C. Call housekeeping for cleanup. D. Report the fall later in the shift. Answer: B. Assessing for injuries and vital signs ensures safe assistance and accurate reporting for post-fall evaluation. A resident with dementia starts wandering toward the exit. The CNA should: A. Block the door and shout to stop. B. Gently redirect them to a safe activity. C. Lock the resident in their room. D. Call security immediately. Answer: B. Gentle redirection avoids agitation and maintains dignity while ensuring safety for cognitively impaired residents. When measuring liquid intake, the CNA should record: A. Only water and juice. B. Any fluid that is liquid at room temperature. C. Only what the resident drinks in the dining hall. D. Solid foods that contain moisture. Answer: B. All liquids, including soups, gelatin, and ice cream, count as fluid intake when measuring hydration. During catheter care, the CNA should always clean. A. From the tubing toward the body. B. From the meatus downward away from the body. C. Only around the drainage bag. D. In any direction as long as gloves are worn. Answer: B. Cleaning away from the body prevents bacteria from entering the urethra, reducing infection risk. A resident begins to choke while eating and cannot speak. What should the CNA do first? A. Perform the Heimlich maneuver. B. Pat their back firmly. C. Give water. D. Call the nurse without intervening. Answer: A. The Heimlich maneuver expels obstructing material by creating pressure in the lungs, saving the airway. When assisting with ambulation using a gait belt, where should the CNA position their hands? A. On the resident's shoulders. B. Under the arms. C. Grasping the belt from behind. D. Holding the resident's hand. Answer: C. Grasping the belt from behind allows safe control and balance during ambulation. The CNA accidentally touches a sterile dressing with ungloved hands. What should they do? A. Proceed carefully. B. Ask the nurse for a new sterile dressing. C. Cover it with another bandage. D. Wipe it with alcohol. Answer: B. Once contamination occurs, the dressing must be replaced to maintain sterility and prevent infection. Which of the following is an example of a psychological need? A. Safety. B. Oxygen. C. Belonging. D. Nutrition. Answer: C. Psychological needs include emotional well-being, belonging, and self-esteem, essential for holistic care. While performing oral care for an unconscious resident, the CNA should: A. Use a large toothbrush. B. Position the resident on their side. C. Pour water directly into the mouth. D. Avoid using oral swabs. Answer: B. Side positioning prevents aspiration during oral care by allowing fluids to drain from the mouth. When dressing a resident with right-sided weakness, the CNA should: A. Dress the weak side first. B. Dress the strong side first. C. Have the resident dress themselves. D. Dress both sides simultaneously. Answer: A. Dressing the weak side first makes the process easier and less painful for the resident. A resident complains that another CNA took their personal items. What is the proper action? A. Ignore the complaint. B. Report the concern to the charge nurse immediately. C. Apologize but take no further action. D. Tell the resident they're mistaken. Answer: B. All allegations of theft or mistreatment must be reported immediately to protect residents and comply with legal duties. A CNA overhears a nurse discussing a resident's medical condition in the hallway. What should the CNA do? A. Join the conversation. B. Walk away and report the privacy breach. C. Repeat the information to family members. D. Ignore it unless asked. Answer: B. Sharing private health information in public violates HIPAA. The CNA must report it to protect confidentiality. Which of the following is an example of neglect? A. Forgetting to answer a call light promptly. B. Accidentally spilling water on a resident. C. Failing to provide meals or hygiene care. D. Speaking rudely to a resident. Answer: C. Neglect is failure to meet a resident's basic physical needs, causing potential harm or discomfort. A resident on a soft diet asks for potato chips. The CNA should: A. Give them anyway. B. Explain the restriction and offer an alternative. C. Ignore the request. D. Remove chips from sight. Answer: B. Educating and offering alternatives supports compliance while maintaining respect and understanding. During feeding, a resident starts coughing repeatedly. What should the CNA do first? A. Stop feeding and check for breathing difficulty. B. Encourage them to continue eating. C. Give water quickly. D. Tap them on the back. Answer: A. Coughing may indicate choking or aspiration risk. Feeding should stop until the airway is confirmed clear. A resident suddenly becomes short of breath while in bed. The CNA should: A. Lay the resident flat. B. Sit them in Fowler's position and call the nurse. C. Encourage deep sleep. D. Give oral fluids. Answer: B. Upright positioning eases breathing by reducing lung pressure. Notify the nurse for further assessment. Before applying restraints, the CNA must: A. Apply them immediately in emergencies. B. Get a doctor's order and follow nurse's direction. C. Ask family permission only. D. Tie them to the side rail. Answer: B. Restraints require a physician's order and supervision. Applying without authorization violates resident rights and facility policy.